Good afternoon. It is afternoon now. Madam Chair and members of the committee. My name is Brian Tinglin. I'm a clinical supervisor approved by the American Association for Marriage and Family Therapy with 20 years of professional counseling experience. I've taught courses on human relations and psychology. I'm an award-winning TV writer-producer for CBS affiliate on programs addressing teenage sexuality and identity. I have 35 years of experience with youth, including being a child and adolescent mental health therapist. If you were to read the prominent mental health medical associations, some of those were mentioned earlier, statements on sexual orientation, if you read those statements, their recommendations can be summarized with two main points. Homosexuality is not a mental illness to be cured. A client should not work with a therapist who is trying to cure homosexuality. Many therapists, including myself, agree with these 2 points, or these two positions. However, I'm opposed to this bill because it is not possible to implement into therapy context. Okay, this might sound like an outrageous claim, but here goes, and you'll have to hear the language. This bill's definition of conversion therapy is not a definition of therapy at all. It is a list of concerns or goals that a client may inquire about or seek services for. There is no professional standard definition of conversion therapy. It has no theory to guide, no techniques to practice, and no therapeutic stance. There is no regime of treatment, and if there were a regime, this bill would need to define it and its harmful or what's unprofessional about it so that therapists would know how to avoid harm. This term is defined however the writer decides. It is troubling that a term like conversion therapy, which is not a therapy at all, but rather a category of therapists working with a specific population, can imply harm is being done when there is no defined, tangible, or measurable theory to practice or an offense to cause. With this ambiguity, therapists would have no protection from accusations of substantiated wrongdoing. I believe the heart of this bill, among other reasons, is to provide protection for sexual minorities from disapproving parents or other authority figures seeking to find therapists who will cooperate with a plan to fix or cure the child. I've had this happen numerous times in my practice. It takes a skilled clinician to know how to partner with parents who may have an inappropriate agenda or do not understand how therapy works. When those parents come to me, I could turn them away. Rather, I choose to help them process their concerns, educate them, and aid with their child's development. We need to discipline poor therapists, not imaginary therapies that don't exist. There are laws in place for those who make false claims and provide poor therapy. It's interesting to me, there's all these therapies that are, all these therapists allegedly out there that are doing all this bad therapy. Nobody can name anyone. Nobody calls them into accountability. Where are they? I went to the suicide training that's mandatory, I'm almost done, and there's two imperative standards of practice that protocol for suicidality was shown to be hugely flawed. Two standards of practice were shown to be working with vulnerable populations. Clients need to be in control of their treatment because it safeguards against perpetuating helplessness and hopelessness. Therapists must be allowed to make difficult clinical assessments and decisions without fear or penalty when there's undesired outcome. I ask you to carefully consider the implication of passing a vague regulation that makes our job more difficult by questioning our clinical judgment, intimidating professionals most qualified to work with vulnerable youth, and possibly stigmatizing a parent or a minor's ability to ask for help. I challenge you to question me on any of my facts, and I can back them up. On any of these organizations.
And Mr. Tingley, you're reading from your remarks. If you could leave those with staff, we'll be sure to look them over more carefully.
I hope they do.
Yeah. Thank you, Madam Chair.